I'm about to share something that changed my life at 71 years old. And it might sound too simple to be true. 5 specific vitamins reversed my prediabetes, cleaned out my clogged arteries, and got me off 4 prescription medications. I know what you're thinking. Vitamins? Really? That's what I thought too. But I'm Robert Mitchell. I'm 71. I live in Tampa, Florida. And 6 months ago, my vascular surgeon sat me down and explained something that neither my primary care doctor nor my endocrinologist had ever told me in 20 years of managing my blood sugar and cholesterol. These 5 vitamins, taken correctly at the right doses, can literally reverse arterial plaque buildup and restore insulin sensitivity. Today, I'm going to share exactly what my surgeon told me, which vitamins he recommended, the specific doses that worked, the research that supports this, and the dramatic changes I experienced. If you're over 60, dealing with prediabetes or type 2 diabetes, high cholesterol, or cardiovascular concerns, you need to hear this story. Let me tell you what happened. My name is Robert Mitchell. Most people call me Rob. I'm 71 years old, and I live in Tampa, Florida, specifically in the Palma Seca neighborhood near Bayshore Boulevard. I've lived here for 22 years. My wife Patricia and I moved from Ohio when I retired from my 38-year career managing a manufacturing plant. We fell in love with Tampa immediately. The beautiful Tampa Bay waterfront, Bayshore Boulevard with its continuous sidewalk, perfect for walking, Hyde Park with great restaurants and shops, the Tampa Riverwalk downtown, Busch Gardens nearby, gorgeous beaches on the Gulf Coast just 30 minutes away. We bought a 3-bedroom ranch-style home with a screened lanai overlooking a small lake. Patricia and I had wonderful years here. Morning walks along Bayshore, watching the sunrise over the bay. Afternoons at the Florida Aquarium or the Tampa Museum of Art. Dinners at Burns Steakhouse or Columbia Restaurant in Ybor City. Weekend trips to Clearwater Beach or St. Petersburg to visit the Dali Museum. Patricia died 2 years ago from complications of breast cancer. She fought for 3 years, and losing her absolutely devastated me. But living alone forced me to confront health issues I'd been ignoring or minimizing for years while I was focused on caring for her. And the issues were serious. I'd been pre-diabetic for 15 years, with fasting blood sugar consistently between 110 and 125 mmHg DL. My A1C hovered around 6.1 to 6.3, not quite diabetic, but dangerously close. My cholesterol was terrible. Total cholesterol, 240 mg/dl, LDL 160 mg/dl, triglycerides, 220 mg/dl. I was on metformin for blood sugar, a statin for cholesterol, a blood pressure medication, and a baby aspirin daily. At 71, weighing 218 pounds at 5'11", I felt tired constantly, had no energy for activities I used to love, experienced occasional chest tightness, and had peripheral neuropathy, tingling and numbness in my feet from years of elevated blood sugar. 8 months ago, I had a routine follow-up with my vascular surgeon, Dr. Michael Brennan, at Tampa General Hospital on Davis Islands. I'd been seeing him for 2 years because of peripheral artery disease, reduced blood flow to my legs causing pain when walking. During this appointment, Dr. Brennan ordered a carotid ultrasound to check the arteries in my neck. The results were concerning. Significant plaque buildup, about 40% blockage in my right carotid artery. He said, "Robert, we need to talk seriously about your cardiovascular health. You're heading toward a stroke or heart attack if we don't change course dramatically." I expected him to prescribe another medication or recommend surgery. Instead, he said something that shocked me. "Before we consider invasive procedures, I want you to try something that most doctors don't talk about, but that research increasingly supports. Therapeutic vitamin supplementation, specifically targeted at reversing arterial plaque and improving insulin sensitivity. 5 specific vitamins, taken at therapeutic doses, have been shown in multiple studies to actually reverse plaque buildup, improve endothelial function, and restore metabolic health. I was skeptical. Vitamins? I'd been taking a basic multivitamin from Walgreens for years. How could vitamins make a real difference? Dr. Brennan spent over an hour explaining each vitamin, the mechanisms by which they work, the research supporting them, and the specific doses I needed. He said, "Rob, most people take vitamins at nutritional doses, just enough to prevent deficiency. What I'm recommending are therapeutic doses, doses high enough to actually create physiological change. This isn't a replacement for your medications right now, but if this works as I expect, we may be able to reduce or eliminate some of them within 6 months." I left that appointment with a detailed plan. I implemented everything exactly as he instructed. 6 months later, the results have been absolutely remarkable and medically documented. My fasting blood sugar dropped from 118 to 92 mmol/dl. My A1C went from 6.2 to 5.4, solidly in the normal range. My total cholesterol dropped from 240 to 185 mcdl, LDL from 160 to 98 mcdl, triglycerides from 220 to 115 mcdl. A follow-up carotid ultrasound showed my arterial blockage reduced from 40% to 28%, actual measurable plaque regression. Dr. Brennan reduced my metformin dose by half, discontinued my statin completely, and said if trends continue, I might come off metformin entirely within another 6 months. I've lost 23 pounds without dieting. My energy has returned, the chest tightness disappeared, and the neuropathy in my feet has improved significantly. Let me share the 5 vitamins Dr. Brennan prescribed and why they work. Vitamin 1. Vitamin D3 at therapeutic dose, $10,000 IU daily. The first vitamin Dr. Brennan emphasized was vitamin D3, but at a much higher dose than typically recommended. He said, "Rob, most doctors recommend 400 to 800 IU of vitamin D daily, maybe 2,000 IU if you're deficient. But research shows that dose is barely enough to maintain bone health. For cardiovascular and metabolic benefits, reversing arterial plaque, improving insulin sensitivity, you need therapeutic doses, typically 5,000 to 10,000 IU daily, depending on your blood levels." He explained that vitamin D is actually a hormone, not just a vitamin. It regulates over 200 genes in the body, including genes controlling inflammation, calcium metabolism, insulin secretion, and arterial health. Low vitamin D, and most Americans are deficient, especially in Florida where we avoid sun exposure because of skin cancer concerns, is directly associated with insulin resistance, diabetes, high blood pressure, and cardiovascular disease. When you raise vitamin D to optimal levels, blood levels of 50 to 80 mmol, you reduce arterial inflammation, improve insulin sensitivity, reduce arterial calcification, and actually stabilize arterial plaque. Research strongly supports this. A 2019 study published in the Journal of Clinical Endocrinology found that vitamin D supplementation at $4,000 to $6,000 IU daily significantly improved insulin sensitivity and reduced A1C in pre-diabetic patients. Another 2020 study in atherosclerosis found that vitamin D supplementation reduced arterial stiffness and inflammation markers in patients with cardiovascular disease. Dr. Brennan tested my vitamin D level. It was only 22 ng/ml, severely deficient despite living in sunny Florida. He prescribed 10,000 IU daily of vitamin D3, cholecalciferol, not D2. I bought nature-made vitamin D3, 10,000 IU soft gels from Publix on Southdale Mabry Highway. After 3 months, my vitamin D level rose to 62 ng/ml, optimal range. That's when I started noticing energy improvements, better sleep, and reduced joint pain I'd attributed to aging. Vitamin 2, vitamin K2, MK7, 200 mg daily for arterial calcification. The second vitamin was vitamin K2, specifically the MK7 form. Dr. Brennan said, "Rob, this is the vitamin almost nobody knows about, but it's absolutely critical for arterial health. Vitamin K2 activates proteins that remove calcium from your arteries and deposit it in your bones where it belongs. When you're deficient in K2, and most Americans are, calcium builds up in your arterial walls, creating hard, calcified plaque. That's what we're seeing in your carotid artery." He explained that vitamin K1 is found in leafy greens and helps with blood clotting. Vitamin K2, specifically the MK7 form derived from fermented foods, activates matrix glyprotein, MGP, and osteocalcin, proteins that regulate calcium. MGP literally pulls calcium out of arterial walls. Osteocalcin deposits it into bone. When K2 is deficient, calcium goes where it shouldn't, your arteries, and doesn't go where it should, your bones. Supplementing therapeutic doses of K2 reverses this process. Research confirms this powerfully. A landmark study called the Rotterdam Study followed 1,400 people for 7 years and found that those with the highest vitamin K2 intake had 57% lower risk of dying from heart disease and 26% lower risk of dying from any cause compared to those with lowest intake. Another study published in Thrombosis and Hemostasis found that vitamin K2 supplementation at 180 to 360 mcg daily for 3 years significantly reduced arterial stiffness and slowed arterial calcification progression. Dr. Brennan prescribed 220 mcg daily of vitamin K2, MK7 form. I bought Life Extension Super K with Advanced K2 Complex from the Vitamin Shop on West Kennedy Boulevard. This contains 200 mcg of MK7 plus other K vitamins. Within 4 months, my follow-up calcium score CT scan showed stabilization of calcification. It wasn't progressing, which Dr. Brennan said was excellent news because it usually progresses 15-20% annually. Vitamin 3, magnesium, 400 milliliters daily for insulin sensitivity and blood pressure. The third vitamin was actually a mineral, magnesium. Dr. Brennan said, "Rob, magnesium deficiency is epidemic in America, and it's directly linked to insulin resistance, diabetes, and high blood pressure. Magnesium is required for over 300 enzymatic reactions in your body, including every reaction involving ATP, your cellular energy currency. It's essential for insulin signaling. When you're deficient, your cells literally can't respond to insulin properly." He explained that magnesium also regulates blood pressure by relaxing blood vessels and balancing sodium and potassium. Your high blood pressure isn't just about sodium. It's probably significantly related to magnesium deficiency. Studies show that 50-70% of Americans don't get adequate magnesium from diet, and diabetes itself depletes magnesium through increased urinary loss. It's a vicious cycle. Low magnesium causes insulin resistance. Insulin resistance depletes magnesium further. Research is very strong here. A 2017 meta-analysis in Diabetologia found that magnesium supplementation significantly improved insulin sensitivity, fasting glucose, and A1C in diabetic and pre-diabetic patients. Another study in hypertension found that magnesium supplementation reduced blood pressure by an average of 5 or 6 mmHg systolic and 2 mmHg diastolic. Dr. Brennan recommended 400 mcg daily of elemental magnesium, specifically magnesium glycinate or magnesium threonate, because they're well absorbed and don't cause digestive upset like magnesium oxide. I bought Doctor's Best High Absorption Magnesium Glycinate 400 mg from Amazon. Within 3 weeks, I noticed my blood pressure dropping. It went from averaging 145/90 to 128/78. My morning muscle cramps disappeared completely. My sleep quality improved dramatically. I was falling asleep faster and sleeping through the night. Vitamin 4, omega-3, Fatty acids, EPA DHA, 2,000 $2,000 daily for inflammation and triglycerides. The fourth supplement was omega-3 fatty acids from fish oil, specifically high doses of EPA and DHA. Dr. Brennan said, "Rob, your triglycerides at 220 ml DLL are way too high. High triglycerides are a major risk factor for cardiovascular disease and are directly related to insulin resistance. Omega-3s, particularly at therapeutic doses of 2,000 to 4,000 millimoles daily, powerfully reduce triglycerides, reduce arterial inflammation, stabilize plaque, and improve insulin sensitivity." He explained that most Americans have a terrible omega-6 to omega-3 ratio. We eat massive amounts of omega-6 from vegetable oils, processed foods, and grain-fed meat, but very little omega-3 from fatty fish. This creates chronic inflammation throughout your body, including your arterial walls. Omega-3s are anti-inflammatory. They reduce inflammatory cytokines, reduce endothelial dysfunction, make plaque more stable and less likely to rupture, thin the blood slightly to reduce clotting risk, and improve insulin signaling. Research is extensive here. A 2019 study published in Circulation found that omega-3 supplementation at 4,000 millimoles daily reduced triglycerides by 25-30% within 8 weeks. The Reduce It trial published in New England Journal of Medicine found that high-dose EPA omega-3 reduced cardiovascular events by 25% in high-risk patients. Multiple studies show omega-3s improve insulin sensitivity and reduce A1C. Dr. Brennan recommended 2,000 to 3,000 millimoles daily of combined EPA and DHA. I bought Nordic Naturals Ultimate Omega-2X with 2,150 EPA DHA per serving from Whole Foods on North Dale Mabry. I take 2 soft gels daily with breakfast. Within 6 weeks, my triglycerides dropped from 220 to 145 mg/dl. After 4 months, they were down to 115 mg/dl, normal range. I also noticed reduced joint stiffness and less brain fog. Vitamin 5, berberine, 1,500 mg daily for blood sugar and cholesterol. The fifth supplement was berberine, a plant compound extracted from various herbs, including barberry. Dr. Brennan said, "Rob, this one isn't technically a vitamin, but it's so powerful for diabetes and cholesterol that I consider it essential." Berberine has been used in Chinese medicine for thousands of years, but modern research shows it's as effective as metformin for lowering blood sugar. And it also significantly lowers LDL cholesterol and triglycerides. He explained the mechanisms. Berberine activates an enzyme called AMPK, AMP-activated protein kinase, which is like a master metabolic switch. When AMPK is activated, your cells take up more glucose, your liver produces less glucose, your body burns more fat, insulin sensitivity improves, and cholesterol synthesis decreases. It's like metformin, but natural and without the digestive side effects many people experience. Research on berberine is remarkable. A 2015 meta-analysis published in Evidence-Based Complementary and Alternative Medicine reviewed 14 studies and found that berberine lowered fasting blood sugar by an average of 20 picomole/dl, A1C by 0.71%, total cholesterol by 18 mg/dl, LDL by 9.6 mmol/dl, and triglycerides by 22 mg/dl. A 2012 study in Metabolism found berberine equally effective as metformin for glycemic control in type 2 diabetics. Dr. Brennan recommended 500 millimoles 3 times daily with meals, 1,500 millimoles total daily. I bought Thorne Research Berberine 500 from the Vitamin Shop. I take 1 capsule with breakfast, lunch, and dinner. Within 4 weeks, my fasting blood sugar started dropping noticeably, from 118 down to 105, then 98, and now consistently 88-94 mg/dl. My A1C dropped from 6.2 to 5.8 after 3 months, then to 5.4 after 6 months. Dr. Brennan was so impressed, he cut my metformin dose in half. The complete protocol and lifestyle changes. Dr. Brennan emphasized that these 5 supplements work synergistically. They enhance each other's effects. He also stressed that supplements alone aren't magic. They work best combined with diet and lifestyle improvements. He recommended I reduce processed carbohydrates and sugars, increase vegetables and healthy fats, walk 30-45 minutes daily, and prioritize sleep. I implemented everything. I walk Bayshore Boulevard every morning, 3 miles along the waterfront. I drastically reduced bread, pasta, rice, and sweets. I increased vegetables, ate more fish, switched to olive oil, ate more nuts and avocados. I prioritized 7 to 8 hours sleep nightly. Combined with the 5 supplements, the results have been transformative. The 6-month results, medically documented. After 6 months on this protocol, Dr. Brennan repeated all my tests. The improvements were dramatic and medically verified. Blood sugar. Fasting glucose dropped from 118 to 92 microgram/dl. A1C dropped from 6.2 to 5.4%. I'm no longer pre-diabetic. I'm in normal range. Cholesterol. Total cholesterol dropped from 240 to 185 mdl. LDL dropped from 160 to 98 mdl. Triglycerides dropped from 220 to 115 mdl. HDL increased from 38 to 52 mdl. Blood pressure dropped from averaging 145/90 to 128/78 without increasing medication. Arterial plaque. Follow-up carotid ultrasound showed blockage reduced from 40% to 28%. Actual plaque regression, which Dr. Brennan called remarkable. Weight. Lost 23 pounds, from 218 to 195 pounds, without calorie counting or feeling hungry. Symptoms. Chest tightness gone. Energy dramatically improved. Peripheral neuropathy in feet 60-70% improved. Sleep quality much better. Medications. Metformin reduced by 50%. Statin discontinued completely. Blood pressure medication reduced by 25%. Dr. Brennan said, at my last appointment, "Rob, these are the kind of results I see maybe once or twice a year. You've essentially reversed 15 years of metabolic disease in 6 months. If you continue this protocol, I'm confident we'll get you off metformin entirely within another 6 months, and your arterial plaque will continue regressing." Practical tips for implementation. If you're interested in trying this protocol, here's what I learned. Get baseline testing. Before starting, get comprehensive labs: fasting glucose, A1C, lipid panel, vitamin D level, magnesium level. Get arterial testing if you're high risk: carotid ultrasound, calcium score, CT scan. This establishes your baseline for measuring improvement. Work with your doctor. Don't do this alone. Share this information with your doctor. Dr. Brennan monitored me closely. Blood work every 6 weeks initially, then every 3 months. Some supplements can interact with medications or aren't appropriate if you have certain conditions. Quality matters. Buy high-quality supplements from reputable brands. I use Nature-Made, Nordic Naturals, Thorne Research, Life Extension, Doctor's Best. Brands that do third-party testing. Cheap supplements from gas stations often contain little active ingredient. Consistency is key. Take your supplements daily at the same time. I take vitamin D3, K2, and magnesium with breakfast. Omega-3 with breakfast or lunch. Berberine with all 3 meals. Set phone reminders if needed. Be patient. Results take time. My blood sugar started improving within 4 weeks, but the full transformation took 6 months. Arterial plaque reversal takes even longer, months to years. Combined with lifestyle, supplements accelerate results, but diet and exercise matter enormously. Walk daily, reduce sugar and processed carbs, eat real food, sleep well, manage stress. Monitor and adjust. Get retested every 3 months. Adjust supplement doses with your doctor based on results. Once my vitamin D reached optimal levels, Dr. Brennan reduced my dose from 10,000 to 5,000 IU for maintenance. My message to you: if you're over 60, dealing with prediabetes, diabetes, high cholesterol, or cardiovascular disease, please talk to your doctor about therapeutic vitamin supplementation. Share this story. Ask about vitamin D3, vitamin K2, magnesium, omega-3s, and berberine. These aren't magic bullets, but combined with diet and lifestyle changes, they can create remarkable transformations. This isn't about ego or wishful thinking. This is about science-backed, medically documented reversal of disease that doctors told me was progressive and irreversible. I'm 71 years old, and my metabolic health is better now than it was at 55. My arteries are actually healing. I'm off one medication completely and reducing others. If this information resonates with you, please leave a comment below, sharing your thoughts. Have you tried any of these supplements? Have you experienced similar issues? Talk to your doctor about this approach. And please hit that subscribe button for more honest conversations about men's health, cardiovascular wellness, diabetes reversal, and evidence-based solutions that actually improve quality of life in our senior years. Drop a like if this information was helpful. It helps other people find this content. Remember, your health isn't necessarily a one-way decline. At 71, I'm proof that reversal is possible with the right approach. I hope my story helps you find your own path to better health.